Hi, everybody. I am back this week and I want to wrap up my period wellness series that we started about a month ago. And this week we're going to talk about birth control pills. I've mentioned little tidbits here or there about how birth control pills have so many side effects and actually mask many of the symptoms that you may be having in your body versus really fixing them. And so I want to go a little deeper on that today. And as normal, stick with me this week. Thursday, I'll share a blog post that will talk about some specific ways that you can approach safely transitioning off the birth control pill, ways to support yourself if you decide to stay on birth control as well. And I'm excited to share that I'm going to do my first Instagram and Facebook Live this week. It's going to be on Friday evening. I'll share more details tomorrow, so look out for that as well. Bring all your period health questions, and I'll be really excited to engage with you all. Okay, so birth control pills. Birth control pills were introduced in about the 1960s, and I do want to start by saying the introduction of the birth control pill has been game-changing, life-changing for many women. It has given us empowerment, the ability to take back control of when we want to have children. It has increased the number of women in the workforce. It has increased women's earning power. It has actually pushed back the average age that most women begin to start their families. And it has given us choice and empowerment over what to do with our bodies. There are a lot of powerful, amazing, good things that have happened as a result of having access to birth control. So that needs to be said and named. However, what is not often shared along with that is, unfortunately, innovations in the area of birth control have not been as frequent and large scale as in other areas of health and wellness. And frankly, many of the solutions that are still in use are fairly archaic. They're not up with the times. And we've learned over the decades that there are a lot of side effects to taking birth control pills over extended periods of time, and that birth control pills have been clinically proven to be a root cause of many chronic health issues that women are experiencing now. And so it's worth discussing and talking about the different options that you have for birth control, really understanding hormonal versus non-hormonally driven birth control and what is right for you in order to be able to control your family planning history, but then also to be able to set yourself up longer term to not be at higher risk for more chronic health issues. It's a really tricky balance. So let's talk a little bit about why people take the pill. Interestingly, more than half of women who are on birth control are actually not taking it to control getting pregnant. They're taking it for other non-birth control related issues like polycystic ovarian syndrome, acne, painful periods, endometriosis. And often in those situations, they're not also told about the ramifications on their body and their hormones for taking them. And it's by well-meaning practitioners, right? They really do want to help us to feel better. It's just that they're often taught to see the pill as a simple solution for fixing whatever lady trouble problems you have, throw a birth control pill at it. But the way the birth control pill works is that it keeps your normal ebb and flow of hormones that should happen throughout each month from happening. It disconnects the communication between the brain and the ovaries, and it essentially flatlines your hormones so they're not fluctuating. That is not normal. And that can cause a whole slew of other issues. And in my practice, I see women often with hormonal imbalances, and they're just simply looking for a solution to their symptoms beyond the conventional, potentially dangerous birth control pill, hysterectomies, in vitro fertilization, and so forth. And so really they're looking for a root cause solution to better understand how to take care of their bodies and how to eliminate their symptoms naturally based on the way that the body was made. You may have heard some of the common side effects of birth control pills. It can make you gain weight. It can cause you to be moody. In fact, women who are taking birth control pills are much more likely to be prescribed antidepressants. On the packaging, it even says there is an increased risk of stroke, but it also is associated with an increased risk of autoimmune disease, heart attack, thyroid, and adrenal disorders. Other symptoms of the pill can include simply hormonal confusion. It can cause missing or irregular periods, light or heavy periods, short cycles, infertility, headaches, digestive problems like leaky gut, gut dysbiosis, inflammatory bowel disorder. It can make your energy be low, fatigue, adrenal and thyroid dysfunction, skin issues like hair loss and dry skin, depression, anxiety, low libido, vaginal dryness, and it also depletes your body of important vitamins, minerals, and antioxidants. That doesn't even mention how it can sabotage your thyroid. It intensifies the risk of blood clots. I had a dear friend who passed away as a result of a history of birth control pills and an unexpected blood clot in the lung. It increases your risk of breast, cervical, and liver cancers, and also the risk of diabetes. So one may ask, if there's something that has this many side effects and risks, why does it exist and why do so many women take it? And the reality is that most of us are just so desperate to have control over when we have children. And be empowered to make decisions that work for us in our life. It's a huge life-changing moment to have kids. But there are other ways to approach this. So, as I mentioned, stick with me this week. If you think you're suffering from side effects from birth control pills, if you're considering getting off the pill and you want some help figuring out how to do that, what to expect, I'll share some tips and best practices. And join me on our Facebook and Instagram Live this Friday, where we'll talk more about the questions that you have about period health. Have a great week, everybody.